All right, wonderful. So we'll go ahead and get started. Thank you everyone for joining us for our Facebook Live today on COVID vaccine updates for Wisconsin on Wednesday, March 24th. I'm joined here by Andy Wheaton, our Manager of Pharmacy Benefits. Here at Network Health, it's really important for us to be able to share this information with you and make sure that our communities are kept up to date with the most recent COVID-19 vaccine information. So we've got a lot this week to cover, and I will go ahead and send it over to Andy to introduce himself and let us know why he is our COVID-19 vaccine expert.
Thanks, Chelsea. Yeah, as Chelsea mentioned, my name is Andy Wheaton. I'm the manager and pharmacist here at Network Health. I co-led our Medicare flu vaccine events this past fall, vaccinating over 7,000 of our Medicare members. And now it's the COVID vaccination time and discussing the COVID vaccines. I had the opportunity last week to actually jump in and participate in a vaccine clinic and provide some vaccines last week, which was a fantastic experience. So this is a passion of mine, and I'm glad to be able to share some of my knowledge.
Absolutely. Yeah. If you head to our Facebook page, you can go ahead and actually see some photos of Andy in action too. One housekeeping note that I forgot to mention, we do have Kelly in the chat. She will be able to share any links or anything that we mentioned today. And if you have any questions at all during the live, please feel free to drop them in the chat and we will get to them at the end of the update. So Andy, let's get right into it. There is a new phase of eligibility that began this week. Can you tell us a little bit more about that phase and who's included in it?
Absolutely. So beginning March 22nd, and this was actually moved up a full week from the initial phase description. So March 22nd, individuals that are 16 years of age and older with certain medical conditions that have a greater risk of getting a COVID-19 severe infection are eligible. We can put that information up in our chat box as well. Individuals in this category, this new eligibility, people that have asthma, hypertension, a BMI of 25 qualifies you for getting the vaccine. So if you're in that category, please start thinking about how to schedule your vaccine. This, from what we're being told, this adds an additional about 2 million people from the state of Wisconsin into the eligible population. So a large portion of our membership and our viewers here are now eligible.
Absolutely. That's so exciting. So next big question is, where can eligible Wisconsinites find the vaccine?
Yeah, so I would say most pharmacies, hospitals, clinics are providing the vaccine. It's a matter of just getting signed up at this point. And if you're eligible, I would encourage you to look at our website. We have an interactive map that links to the various vaccination sites. So make sure you do that. So if you're looking for that, we also there's a 1-800 number that if you don't have access or you know of somebody that doesn't have access to a computer, there's a 1-800 number that they can actually help you with as well. Some of the big clinics that opened up this past week, last week actually, we kind of talked about it last week, but I'll mention it again. So Lambeau Field, and in partnership with Brown County, Bellin, and the Packers, opened a site at Lambeau Field in the atrium there, and they're looking to provide vaccines for roughly 6,000 individuals on a weekly basis, and they expect to ramp up based on the supply that they're able to get, up to 10,000 shots per week, which is phenomenal for the area in the Green Bay market. For those that are in the Milwaukee area, the Wisconsin Center was just recently taken over by FEMA to provide vaccinations for local residents down in the Milwaukee area. So if you're down in that area, the Team Rubicon, which is through the disaster relief through FEMA, they took over last week, and they're looking to provide another 6,000 shots per week, and then they'll ramp up based on supply. This also makes additional people eligible in the Milwaukee area. So as long as you're, even if you're not a resident in Milwaukee, they'll still be able to vaccinate you, which is pretty cool.
Yeah, that's big. Yeah, so we've got those folks who weren't able to make it to Lambeau at all this year. Can have a reason to go there and get their vaccines, right?
Yeah, absolutely. I just wanted to point out one other update based on like the locations that are able to vaccinate. So 4 new pharmacies in the state of Wisconsin were added to the federal vaccine distribution program. So these are pharmacies that are getting direct shipment from the federal government. This is above and beyond the allotment that we get at the state level. So this is great news. So the hometown pharmacies, managed healthcare associates, Meijer, and Walmart are all now included in this group. Previous to this, we had Walgreens and Kroger. So now this is just expanding the supply even more, which is great for Wisconsin and our Wisconsinites looking to get vaccinated.
That's excellent news. Very exciting. What other updates do you have for us this week?
Yeah, going back to the Milwaukee area, we talked about the Wisconsin Center and FEMA taking over that operation. In areas of certain areas in the Milwaukee area, zip codes in particular, are going to actually have allow anybody that is 16 and greater. So you don't even have to have pre-existing conditions. I believe Kelly's going to put in the zip codes that are allowed, but you can actually get your vaccine without any requirements based on your location that you're a resident of. So make sure to take a look at that. This is great news to be eligible in this area. So make sure to get out and get your vaccine. A lot of walk-in clinics are opportunities there as well.
Mm-hmm. And can you tell us a little bit more about why it's specific zip codes and why it's not in all of Milwaukee, just to explain that a little bit more?
Sure. Yeah. So these are areas that are a little bit, maybe the need is a little bit greater. The population's a little bit more difficult to reach with traditional pharmacies and clinic appointments. So we're opening it up to make it even easier for this population to get the vaccine, which was exactly what we need to do. It's fantastic.
Wonderful. That's such great news to hear. I know that there was some other news around a potential 4th vaccine coming into the States. Can you tell us a little bit more about that?
Sure. Yeah. So this is the AstraZeneca vaccine. Number of countries throughout the world have already approved this vaccine. The initial data that we've seen is about 79% effective against symptomatic COVID-19 infections, and then 100% effective against serious conditions as well as death. So pretty good results there. This one, from what we're seeing, is the data. It may not be available until May of 2021. This will limit the use in the US since the other 3 vaccines that are already in circulation basically said we'll have enough vaccine available for everybody, any adult that's eligible, in May. So more to come on this one, but just wanted to let everybody know this is another vaccine that's available, and we'll look to see how the FDA reviews it over the next couple months.
Awesome. Good to know. So I have a couple of questions that were submitted to us earlier, and I think that this previous update rolls right into the one of the questions that I have is, let's see here. Can I choose which vaccine I get when I'm eligible, and which one is the best?
Sure. So right now there's 3 vaccines that are in circulation. So the Moderna and the Pfizer BioNTech are mRNA vaccines. The Johnson & Johnson is a viral vector vaccine. So those are your 3 options. All of these are extremely effective in preventing serious COVID-related disease, hospitalization, and death. So they're all nearly 100% or 100% effective. Mm-hmm. My advice is get your vaccine as soon as you're eligible. Get in line, get signed up, get whatever vaccine pharmacies have available. Pharmacies are not able to select which vaccine they can get into stock. So as long as you can get on the list and you're eligible, get your vaccine and don't worry about which one you're going to get.
Yeah, all vaccines are good vaccines right now.
Fantastic. Yep.
So another question we had is, when will children under 16 be able to get the vaccine?
Yeah, so this is a common question that I keep getting, especially with some family and friends.
Mm-hmm.
Right now, we're seeing that Moderna and the Pfizer BioNTech vaccines have been tested in 12 years of age and older. They're
Mm-hmm.
working towards a goal of vaccinating for the upcoming school year. We'll see how that plays out over the next couple months into the summer. We also saw that on the 19th, Moderna released information that they're actually testing their vaccines for 6 months of age up to 11 years of age. And then Pfizer's going to soon follow with that testing as well. Um, it could take, they're thinking that it's going to take a little bit longer for this particular population in those tests, those trials.
Mm-hmm.
One of the big reasons is that we're starting to see COVID cases go down. And so to understand and to get some of the data behind it, you're not going to have as large of a population getting COVID and kind of understanding how well the vaccine works in this population. So this could take up to a year to understand this for this particular set of individuals. So that's 6 months to 11 years of age. We may not see that this year yet, but more to come on that. We'll keep you posted.
Gotcha. Absolutely. Yeah, we will definitely share any updates as we have them on this live.
Yeah.
Another question that we're seeing is, what is herd immunity, or as we've kind of seen around the state a little bit, community immunity? Can you explain what that is a little bit more for us?
Absolutely. So this phrase is used to indicate when a large part of the population of an area is immune to a specific disease. We think right now we're focused on the coronavirus. So most experts feel that herd immunity for the coronavirus is somewhere between that 70 to 80%. And this includes those that are vaccinated as well as those that had a recent COVID-19 infection. So more to come on that, but that's just kind of how we look at herd immunity and what it is. So once enough people are resistant to the disease, in this case, coronavirus, you establish herd immunity.
Wonderful. Good to know. I have, let's see here, a couple more questions, but if anyone who is on the live right now has questions, feel free to go ahead and add them into the chat. Now is the time that we can get to some of those. Another question that we have here is, once I am vaccinated, what can I do once I'm vaccinated? I really want to hug people again. I want to see family. So kind of, can you let us know a little bit more what we can do once we're vaccinated?
Sure. I think first of all, it's important to understand what does fully vaccinated mean. So after you get if you're on a 2-dose regimen or the single dose Johnson & Johnson vaccine, whatever your last dose, you're fully vaccinated after 14 days after receiving that last dose. So just kind of keep that in mind as you start to plan for what I'm going to talk about next. So once you're fully vaccinated, the CDC has released some guidelines as to who you can visit with and who you can hug for that matter. So you can gather indoors with fully vaccinated people without wearing a mask. You can gather indoors with unvaccinated people from one other household. So just kind of keep in mind with that. We just don't want the spread if you are carrying the virus. We don't want it to spread to additional families beyond just one. So that's kind of the thought. We're also hearing that the CDC over the next week or two is going to release additional information on gathering in larger groups as well as travel. So once we hear that information, we'll for sure pass it on during our Facebook Live meetings.
Awesome. Yeah, hopefully we'll have some good news to share soon. And then final question that I have submitted ahead of time. Again, I still don't see any questions coming through the comments, which is totally fine. But if there are, now's your chance. Last question that I have submitted to us ahead of time is, are the variants still something to worry about? I know kind of earlier we were hearing a lot about the coronavirus variants. Can you tell us a little bit about where we're at right now with those?
Yeah, so we continue to hear a lot about the variants in circulation. The initial ones were from the UK, and then we heard about South African, and then there was one out of Brazil. These are still in circulation and still a concern, and that's why you're seeing a very large push to get more vaccine into Wisconsinites and basically to all individuals' arms, so that we can be protected against these new variants. We've talked about this in the past, but variants, mutations in viruses are a common thing. We see that with the flu and other viruses. So this isn't unexpected. We just got to keep an eye on the virulence or the likelihood that it's going to cause more severe COVID-related disease. So that's definitely something we're keeping an eye on. I know the Moderna and the Pfizer teams are looking at this information, trying to determine, do we need to do booster shots for the vaccines that we're already getting or will receive. So we'll know more throughout the summer, I'm guessing, and we'll know if this is going to be an annual thing, which it's seeming that way, but that's because of the variants and how we need to adjust the doses.
Mm-hmm. Wonderful. Good to know. Good to know. Thank you so much, Andy. So before we kind of wrap up here, we're going to post this to our page later, so you'll be able to find it for the next week. And then we will have more updates as we get them. Andy, do you have any other final thoughts before we sign off here?
No, I would just encourage you to reach out and look at our website. We have a lot of great information at networkhealth.com. There's a COVID-related link at the top. Please take a look at that. If you have any questions on where to get the vaccine, we have that interactive map, which is a great resource. Mm-hmm. So just make sure you're using those tools and get in line when you're eligible. Get in line, get that vaccine.
Wonderful. Thank you so much. And thank you everyone for tuning in. Bye-bye.
Thank you.